Opioid addiction is a chronic and relapsing disorder. It represents a disease of the brain, primarily of the limbic system, containing the dopamine centers of pleasure, said by Dr. Okus, reported in a medical journal defining the quality of life of opioid addicts and substitute treatment. Opioid addiction or opioid drugs work by attaching themselves to the protein opioid receptors. When attached, they reduce the sensation of pain and produce a powerful sense of euphoria. Opioids also halt the natural production of endorphins, which are part of the brain's pain control system. With addiction, the brain adapts to the drug and produces higher levels of endorphins. But when an addict decides to become sober, the depressed endorphin level caused by the absence of the drug leaves the person feeling physically incapable of feeling any pleasure in life. The high prevalence of opioid addiction has become a major public health problem. According to the American Society of Addiction Medicine, about 2.5 million people in the U.S. are addicted to drugs. This growing number of cases requires a reform in the treatment of opioid addiction. Currently, many treatment centers still use traditional methods such as tapering the addict with a similar drug methadone. However, when patients undergo these treatments, they experience recurring relapses. This shows an ineffectiveness in current methods. Good morning, my name is Sana Siddiqui, and I will be exploring the question, why should recovering opiate addicts be given holistic treatments to increase dopamine levels naturally? First, they focus on the overall well-being. They then address the root causes of addiction, and they manage the risk of relapse. Holistic treatments focus on overall well-being. By replacing opioids with natural dopamine enhancers, it can lead to an individual's overall well-being. More specifically, a study aimed to measure the effects of yoga nidra by Dr. Mudasir, by Professor of Psychology, reported yoga nidra, or psychic sleep, is a systematic method of guided relaxation that profoundly affects the body and mind. It is one of the most powerful methods, not only for the formation of deep relaxation, but also for the revival of degenerative brain nuclei. Opioid drugs can have neurotoxic and destructive effects on the brain and can cause on brain nuclei or brain cells and can cause neurological damage. However, yoga nidra regenerates and synthesizes neurons in the hippocampus, improving memory and reducing the risk of dementia. This form of meditation also decreases chances and effects of withdrawal symptoms. Acupuncture methods also enhance the survival of dopaminergic neurons by activating survival pathways and regulating neurotransmitters. Consequently, the holistic approach focuses on addressing the underlying issues that cause the addiction in the first place. Factors such as peer pressure, physical and sexual abuse, early childhood exposure, and parental guidance can greatly influence the likelihood of a person's drug use and addiction. The College Board provided stimulus, predator-induced fear, causes PTSD-like changes in the brain and behavior of wild animals, states that PTSD-like changes in the brain are not unnatural or maladaptive, but are rather evolutionary, which involves avoidance of trauma-related cues that increase probability of survival by increasing the likelihood of detecting a life-threatening danger and reducing the probability of encountering one. This shows that addiction can stem from evolutionary psychological responses from past traumas, such as feelings, thoughts, activities, substances, and relationships. A way to target this trauma response is by using cognitive behavioral therapy, or CBT, which aims to treat all causes of addiction. CBT focuses on the mind and body and how past experiences can influence current thoughts and behaviors. In contrast, holistic treatments manage the risk of relapse. In contrast, the most common method of treating addiction is by replacing the drug with a similar drug such as methadone. This study done by French Public Health shows that at the initial duration of the treatment, there was 903 participants. At the end, only 710 lasted. And it states that we found 32% of them relapsed in the first 6 months. Among those who persisted in methadone maintenance treatment for 12 months, 39% of them relapsed in the process. This highlights that a successful recovery incorporates a long-term treatment plan that continuously adjusts to the patient's needs rather than replacing the drug and risking the chance of a relapse. However, there are some limitations. One is the stigma, being that opioid addiction is one of the most stigmatized in the world. A case in Sweden found that interviewees were rejected from opioid substitution treatment because they did not meet criteria due to discreet use from family and friends and lack of documentation from health services and police. Also, there is a lack of public resource and education. Many people who start opioids do not know what they're getting into. Like, they don't know the risk of addiction and they don't know how to get out of it, and just put themselves into rehab that puts them on medications such as methadone. Lastly is refusal to stop opioids. This is a general limitation with drugs, since addiction can cause intense drug cravings that makes it difficult to think about anything other than drugs. My solution is holistic rehabilitation. It offers treatments for the whole mind, body, and soul to recover. By combining the components of spiritual wellness with physical and mental wellness components with holistic practices, the recovery is working towards a state of quantum wellness that will be sustained for years to come. Ultimately, holistic treatments have much more benefits than pharma drugs. By engaging in healthy dopamine-enhancing activities, a person in recovery from opioid addiction has a better chance of recovering and maintaining a life of sobriety. Recovering from opioids can be a very overwhelming process, so having the right intricate care can lead to the ultimate treatment. Thank you.
All right, 2 questions. First one, how did you select what strategies you were going to use to do your research?
So what I did, I went by what I already knew and like how opioids are already a big major public health issue, and I went chronologically. So how does it affect the brain, and what are the methods of treatment, and how the treatment cannot be sustained, and it has a big risk of relapse. So then I went to a holistic approach, which I found that had more benefits, especially for relapse.
All right, and what advice would you have for other people who consider this in the future?
I would say to use research already done with trials and studies. Like, I used the Frontier Public Health, and I found that many people had dropped out of the treatment because of the amount of relapse they had, and that they didn't have enough support, such as psychotherapy or CBT, which is one of my solutions.